Hi, this is Dr. Robert Brueck coming to you again with another segment of What's New in Cosmetic Surgery. During these episodes, we talk about different techniques, different trends, new ideas, new technology, and it's all trying to help you make a more informed decision about the potential to have cosmetic surgery. I think it's important to be informed today. The internet certainly has boosted patients' knowledge about different cosmetic procedures, but this is just another tool. Now, there may be certain things you would like me to discuss or do research on. Feel free to contact me on my website, Beauty by Brueck. My phone number is 239-244-2329. Again, the consults are complimentary because I don't want to have anybody have pressure in having to go pay a fee to get some evaluation, get some ideas, and find out what the possibilities are. First thing I want to talk about today, it was an interesting article I read where they studied 100 breast dog patients. And what they tried to do was to catalog different preoperative conditions of the patients to determine if it was a challenging breast dog case or a simple straightforward case. And I think it's important to understand, and I tell this to all my patients, whether it's not just breast augmentation, it could be a tummy tuck, a facelift, liposuction, whatever the case may be. I have to take what you give me and maximize your expectations. I can't change. For example, if you have a narrow chest wall, I can't say, you know what, Barbara, add 3 inches so you'll be a more ideal candidate. I can't do that. So I have to take what you give me, use my 37 years of experience to maximize your game. So what they did was they cataloged pre-existing conditions as major. For example, people may have had a deformity to the chest wall, such as a pectus deformity where the chest bone is caved in, or carneatum where the chest bone is like a bird's chest bone pushing out. There are individuals who, for example, have scoliosis, and so there's a tilting, if you will, of the spine. All these are complicating factors that will affect the outcome of the breast augmentation. There are other things too, such as the anatomy. Does somebody have a narrow chest? I always tell my patients the least favorable candidate for a breast aug is somebody who's maybe 5'6", 5'7", 5'8", weighs 110 pounds, has never been pregnant, is skin on bone, you can see rib cage, says, I want 600 cc's. So it's really important as a prospective patient that you don't set up unrealistic expectations that can't be delivered based on your anatomy. Some of the other minor aspects of preoperative breast aug evaluations were people, for example, that had a little asymmetry, if you will, to the inframammary fold. One nipple may be positioned more lateral. There may be a little difference in the vertical positioning of the nipples. There may be a condition called pseudotosis. Basically what it is, it's like somebody let the air out of the balloon. But the nipple is still above the fold, so we call that pseudotosis. So they consider these minor circumstances that affect the outcome of the final breast augmentation. At the end of the day, it's important to understand that it's the skill of the surgeon, it's his experience and knowledge that will help assure you of a good outcome. So again, it's important to understand the difference between different patients. So many times a young lady will come in to see me for breast aug. She'll say, well, my girlfriend had 600 cc implants put in her, 500 cc implant, and that's what I want. Well, her body may be able to tolerate because her chest may be broad, may be deep or wide or high, and she can accommodate a 500 cc implant. And I always tell people, at the end of the day, I got to be able to close the incision once I make that pocket. So be understanding, do your research, do your homework, and make sure that the person you go to has the requisite skill and knowledge to maximize your expectations and gain. The other thing I want to talk about, continuing on the vein of breast augmentation, has to do with encapsulation. I've done hundreds of breast augs over the years, and the one thing that is annoying, and again it's out of my control, is encapsulation. When you have a breast aug done, understand one thing: the doctor is putting in 2 foreign bodies, and those foreign bodies will elicit an inflammatory response, and in response to that, collagen will be formed around the implants, forming a capsule. Everybody gets the capsule, but it's intriguing to understand why some people's breasts maintain a soft, natural appearance over the years, and other women will come back at 3-4 years and the breast will be rock hard and firm, maybe tender and sore, and embarrassing to the patient. They don't want to hug anybody because it's like hugging two rocks. So one of the interesting theories now about severe encapsulation has to do with the concept of biofilm. And what it has to do with, as the implant is inserted into the cavity, the pocket, it comes in contact with obviously the skin on the individual, and that skin has all kinds of different bacteria on it, and somehow they take residence on the implant surface and form what we call a biofilm. And so these bacteria come in there and form this biofilm, secrete different material to maintain their attachment, if you will, to the implant surface. What's interesting to note is many times when biofilms form, there's more than one bacteria that's present. Now, one of the questions that was asked, and again, it's very controversial, is do you have less biofilm with textured implants or smooth? Now, some studies say if you have a textured implant, then you increase the likelihood of a biofilm forming, whereas with a smooth one, you don't. I generally don't use a textured implant as my primary choice of implant. I usually use smooth silicone. And sometimes with the biofilm, it's very difficult once it's established to really get rid of it. It creates an inflammatory reaction. The capsule can thicken, it can get firm and hard. So what are some of the things that we can do to minimize the formation of a biofilm and hence severe encapsulation? Well, the couple things I do. Number one, I give all my patients prophylactic antibiotics intravenously just before the start of the procedure. So that way, the antibacterial solution will be circulating in the body when we perform the actual augmentation. Another thing that I do, and this is probably something I've been doing the last couple, 3-4 years, is to give patients Hibiclens, which is an antibacterial soap. So what I have them do a couple times starting 2 days before or a day before the surgery, wash their chest with this antibacterial soap with the idea that you cut down on the bacterial count and lessen the likelihood of a biofilm forming. One of the most common bacteria in the skin is an organism called Staph epidermidis. And by utilizing Hibiclens, you can go ahead and minimize that. Another thing is choice of incisions. What I normally do is we'll do an inframammary incision. The dirtiest part of the breast is the nipple-areolar complex. So I tend to avoid that. Now what some surgeons will do is they'll put a sterile pad over it to minimize contamination. I just avoid it. I make an inframammary incision. I think that's the cleanest incision to use if you want to minimize bacterial colonization of the implant surface. The fourth thing that I do is I use a triple antibacterial irrigation. So once the pocket is made, I make sure that there's very adequate, excellent hemostasis, no oozing or that. And then I irrigate the pocket with this antibacterial solution. Sometimes I just let it sit in there, and I leave a little extra in there as I insert the implant into the pocket before closing. Now, these are not a guarantee that you won't get a capsule. Some of the things I do post-op is have patients do massaging. So maybe 2 days post-op, 3 days, depending upon comfort, I'll have patients massage in a circular fashion. The idea is to massage the implant, keep the pocket expanded so it doesn't contract and get hard. Again, it's not a guarantee, but these are some of the things that can happen and that you can do and that we can do to minimize that likelihood of a severe encapsulation. And also over the years, people that develop a hematoma post-op seemingly have a higher incidence of encapsulation than people have no hematoma. And it's been my experience, thin people will go ahead and have a higher incidence of hard encapsulation versus people that have more soft tissue coverage. And that's one of the reasons now I start recommending to many patients doing a composite aug, where we put the implant in and then I harvest fat from, say, the tummy or the flanks or the inner thigh and utilize that soft tissue to cover the implant. So again, everybody gets the capsule. Our job is to minimize severe encapsulation. The last thing I want to talk about today is a procedure called a brachioplasty. we see more and more people coming in requesting brachioplasties or arm lifts. More and more patients have bariatric surgery performed, and they lose 50, 80, 100, 150 pounds. And so one of the things they have is an excess of loose skin. Makes it very unsightly if they want to wear a bathing suit or putting their arm through the sleeve of a blouse or a shirt or anything like that. And it's very annoying and very embarrassing to them to have this extra soft tissue. It's important to understand it's not just with brachioplasty, with any type of cosmetic procedure. If you have loose skin, you have to remove it and cut it away. There are no creams or lotions that you can put on it to go ahead and whisk it away. So you have to cut it away. Now, the type of brachioplasty performed depends on what kind of excess you have. For example, if you just have a little excess here, a mini brachioplasty where you have an incision in the armpit this way may be adequate with a little liposuction. But if you have a big fold of loose skin here, then you have to have a full arm lift. And the incision will go all the way along the inner aspect of the arm. So when the arm is down to the side, you don't see the incision. But again, it's important to understand that a brachioplasty is removal of excess skin and fat. And the idea is to contour the upper arm so it's in proportion to the forearm. You don't want to have a skinny upper arm and a full forearm. I always think of Popeye and olive oil, you know, with the skinny arms. So we always try to make it proportional. But it's a very, very popular operation. More popular now, I would say, in the last 2 or 3 years. I see more and more patients for brachioplasty. The trade-off is you get a scar. You can't get around it. But you get rid of all that loose skin and excess fatty tissue so that when you wear clothes, your arms will look more symmetrical, they'll look more proportional. And I think it's true not just in arm lifts, but in tummy tucks, thigh lifts, whatever. So keep that in mind. There's no magic bullet, there's no magic solution, no magic creams or wands. So always make sure you understand the anatomy and understand what needs to be done to get it to where you want it to be. Again, I thank you for listening in to us. Again, if you have questions, you can call me at the office, 239-244-2329, or go to my website, Beauty by Brueck, email me, and I'll be more than happy to answer any questions you might have, go into any issues or types of procedures or products that you've read about before you spend some unnecessary money to go ahead and pursue a dream that's not going to come true. Again, thank you. I wish you all the very best. Have a great week and look forward to meeting with you again soon.